CBR is the Center for Brain Recovery. When patients come to a residential treatment program, things are not going well. There are so many reasons why someone might be struggling, whether it's alcohol and drugs, mental health issues, medical issues, trauma history, or just really significant amounts of stress in their life. All of these things impact the way that our brain functions, whether that's cognitive or emotional. So Center for Brain Recovery and the services that we offer are all about focusing on mindfulness, giving people tools, giving people actual tangible things to do to help stimulate their brain, to help them engage in different kinds of activities in a different way. We're talking about meditation. We're talking about the way that we manage stress. What are different kinds of coping skills? We talk so much about mindfulness and coping skills in CBR, and these are things that are going to have a positive impact by decreasing depression, decreasing anxiety, decreasing our trauma response. And so everything that CBR does has that focus of mindfulness. All of those things are going to impact our function, and so we're trying to provide patients with a tangible way to manage all of those primary issues that they're coming to treatment with. Mindfulness is the ability to be present, to be aware of what's going on around you in the moment. It's a really powerful grounding technique that is really helpful in managing anxiety, managing panic, even, managing trauma or dissociative symptoms. Learning how to be present and just be aware of what's going on around you. It's the basic premise of mindfulness, and there's a lot of different ways to be mindful. You can engage in mindful eating exercises where you're really focusing on the taste of the food and the texture of the food and taking in every part of the eating experience. You can do guided meditations where it's about understanding how your body is responding and noticing your body and the different tensions in your body. It can be practiced in such a variety of ways, but the basic premise of it is just be here, be now, be aware, be present. There's been an incredible amount of research that really shows us how mindfulness-based activities change our brain and change the structure of our brain. And so engaging in mindfulness-based activities helps to stimulate the parasympathetic nervous system, which in the brain is kind of like the regulation tool, the shut-off valve in a very simplistic way of our fight or flight response. So when we see patients come in with various anxiety disorders or trauma history or panic disorder, what those folks are often experiencing is an increase and an overstimulation of that fight or flight response. And so a lot of the mindfulness-based activities that we focus on in CBR are going to help to give people a better handle on how to regulate that fight or flight response, bring their stress down, engage in relaxation techniques, and teach their brain how to relax and how to calm down. We use different handheld devices. We have a biofeedback device that focuses on our breath and our heart rate so that patients can get a better understanding of the way that they're breathing and how is their heart responding when they're trying to meditate or relax. And we also have a neurofeedback device that we use that focuses on brain activity. So when we're talking to our patients about meditation and mindfulness, so many people don't really know what that is and they don't know how to do it. And our primary goal is to help make sure that patients learn how to do it properly. When we talk about being calm and focused and we want our brain to behave in a certain way, we use a neurofeedback device and attach it to people's foreheads, and is their brain calm and focused? It's reading the brain activity. So we use these biofeedback and neurofeedback devices to make sure that patients are learning these techniques properly so that they can practice it daily and thus get the incredible benefit that mindfulness has been shown to bring in all of the different research.